Monika Paul is the founder of the method Musicoterapia con l'arpa with the harmonic sound bed. Classical homeopath, natural practitioner, nurse and music therapist. The Musicoterapia con l'arpa method uses music, other natural energy healing methods, and types of integrated medicine on the harmonic bed with 112 strings tuned in 432 Hz. The keys to the method are vibration, frequency, and sound. This method is inspired by the study of water memory made by Masaru Emoto, whom Monika Paul knew personally. The Musicoterapia con l'arpa is the result of experimentation and professional experience gained by Monika Paul over the past 30 years. The human body is composed of about 70 to 80% water. The human body is composed of cells. The cellular fluid moves within them, and there is always a vibrating energy present. Each organ vibrates with its own independent frequency. You can really say it is like a big orchestra. All organs play in harmony with each other. This process is governed by a vital force, or chi. When someone gets sick, the frequency, the vibration in the cell, changes. So you can say that the human being vibrates disharmoniously. On the 112-string harmonic sound bed in 432 Hz, the person feels these vibrations thanks to the water in the body, and especially hears them in the interference fields of the body. Together with the patient, the therapist first tries to identify these out-of-tune cells, and then stimulates them to retune, to return them to their natural harmony. Musicoterapia con l'arpa, with the harmonic sound bed, is a music medicine therapy that works with frequencies of 432 Hz. The person feels these vibrations, senses their energy blocks, and through the treatment notices a positive effect on a physical, emotional, and spiritual level. In September 2020, Monika Paul began a research project lasting about a year in the Department of Oncology of the Hospital Alta Valdelsa in Poggibonsi, precisely in the day hospital where chemotherapy is carried out under the direction of the chief doctor Martignetti. The medical team was composed of 6 doctors specialized in oncology and chemotherapy. All patients who participated in the study with the Musicoterapia con l'arpa, with the harmonic sound bed, came from this department. The project was given the name ARPAS, which means Harmony, Relaxation, Comfort, Symptom Relief. The ARPAS project involved the combined study of 60 patients, of whom only 30 would receive treatment on the harmonic sound bed. The other 30 would be used as a control reference within the research. All patients would have their pulse rate, blood pressure, and blood oxygen saturation checked before and after chemotherapy and noted in their medical records. The 30 patients undergoing Musicoterapia con l'arpa had a session on the harmonic sound bed before and after chemotherapy. These patients underwent a total of 8 multiple sessions on the harmonic sound bed. All 60 patients were administered the following questionnaires: 1. Mindfulness scale, 2. The stress thermometer, and 3. The Hamilton scale for depression. The various sessions of the ARPAS project on the 112-string harmonic sound bed were carried out in the following way. The patient lies down on the harmonic sound bed. Monika Paul performs an energetic diagnosis on the harmonic sound bed. The person is asked to pay attention to his or her physical, emotional, spiritual, and mental sensations, and to pay attention to the areas and zones where the vibrations pass through the body and how and where they expand or extend, and what kind of tones particularly move their emotions. At the end of the treatment, patients share the experience, writing a clinical journal about their feelings, their experiences, and their dreams. In addition, the patient chooses one or more tuning forks, each with a certain frequency, according to his or her unconscious preference and subjective well-being. The tuning forks used in therapy are chakra set, meridian set, organ set, solfeggio set, Fibonacci set, DNA set. The patient is also taught breathing techniques according to Middendorf and pranayama, related to interference fields, organs, sensations, and mind, which necessitate the therapy. With this therapy of the tuning forks and their diverse vibrations, an individually adapted therapy is realized for the inner harmony of the human being and for the repair of human cells and organs. The guidelines of classical homeopathy, the Tao, the meridians, the 5 phases of transformation from Chinese medicine, and the teachings on chakras, pranayama, nada yoga from Ayurveda, have helped Monika Paul to identify a specific therapy for each patient. After the treatment, the patient undergoes chemotherapy. After chemotherapy, the person lies down again on the harmonic sound bed and undergoes a new music therapy treatment with the harmonic bed. Also at the end of the second treatment, the patient is asked to share and write down the feelings that they have experienced. Homework is also given for the patient to work on positive internal changes.
Mi chiamo Angelo Martignetti, sono il direttore dell'oncologia della...
My name is Angelo Martignetti. I am the head physician of the oncology department of the Alta Valdelsa area, which belongs to the group of ASL, Southwest Tuscany. We were happy to participate in the research study aimed at improving the quality of life of our patients, and we decided, since some experiences, in short, of some single patients, seemed to give an interesting result, we decided to make our own clinical research in order to demonstrate scientifically, with objective methods, that this treatment is effective.
Dimostrabili scientificamente con dei metodi oggettivi che ci dimostrassero l'efficacia di questo trattamento per migliorare la qualità di vita dei nostri pazienti.
L'esperienza della musicoterapia con l'arpa.
The experience of the Musicoterapia con l'arpa method, harmonic harp music therapy, was very well received by our patients, in particular one of my patients who was very afflicted by the suffering of the disease, breast cancer with bone metastases, and by the suffering of having lost a 20-year-old grandson a year ago to a car accident, felt understood and treated in full by Monika Paul. After the music therapy sessions, the patient presented an improvement in the physical state for the reduction of bone pain from metastases and an improvement in her mental and psychological state. I can say that in the period of absence of Monika and the suspension of music therapy, the depressive state of the patient has recurred in a strong way to the point of requiring pharmacological help. Monika, thanks to the use of her harmonic sound bed, has managed to get in tune with our patients and to lighten their emotional load in dealing with oncological treatments. I hope that the research of the method of Musicoterapia con l'arpa with the harmonic sound bed can lead to good results in the field of oncology and can establish itself more and more in the hospital environment. A special thanks to Monika Paul for all the commitment and passion she has shown in recent months working at our oncology daily hospital. When I started chemotherapy, I was offered to do this ARPAS therapy, and I accepted. In this way, I realized that the vibrations enter my body cells when these strings are played, and as for me, I always feel a great sense of warmth throughout my body, especially in my legs, feet, and hands. Last time I also had a different feeling, as if these vibrations were running directly over me, over my legs. For me, it was also important to breathe, because if you breathe in and out forcefully, you can relax and control your body to get through chemotherapy without panicking. the patient has had an experience with an allergic reaction from chemotherapy. Breathing therapy relaxed me. For me, it was a new and positive experience that I recommend to all cancer patients.
Che consiglio a tutti I malati oncologici. Quando mi hanno proposto questo.
Well, let's say that when the project was proposed to me, I was skeptical at first, because I'm a very clinical, rational person, so I didn't really believe in it. But I said to myself, let's try it. Why not? We started the project, and from the very beginning, when I was lying on the harmonically tuned sound couch, especially the first time, I felt that the vibrations were felt in my surgical area, in my chest, in a very strong way. I felt very strong vibrations inside me. In addition to the vibrations in the body, I felt a strong emotion and also slight vibrations in the head. This was, let's say, a reflection of my other problem. Because my other problem was the problem of psychological stress that had caused the disease. So besides the problem of the chest, there was also the problem of the psyche, the soul. The special thing is that I immediately felt it very strongly, especially in the first session and also in the second. Then, when the sessions were over, there were 8 sessions. During the last 2, the special thing was that these vibrations stopped outside the body, as if they were slipping. As if they stopped going inside, they went outside. It was really nice, a beautiful thing, both on the level of relaxation before and after chemotherapy, and at the level of the head. Because thanks to these sessions, I was also helped psychologically. I can say that these sessions helped me more than the psychological help from the hospital. I have a family history that is quite a bit emotional. I have a pretty strong family history where the experience of cancer is, unfortunately, a constant. And I expected to face cancer as well, though not as young, but I expected it. When I was diagnosed, of course, I was under psychological stress, which led to isolation. So I spent my days isolated from everyone, my family, my children, in a room in the dark, doing nothing. On top of that, there was the fear of COVID. Because I had to have chemotherapy sessions, but they were tied to whether or not I got COVID, I was afraid I wouldn't be able to attend the therapy sessions. So there was isolation within isolation, if you can call it that. Because I had to be isolated in a room to avoid contact with my children who were going to school and could be carriers of COVID. So the psychological stress was highest at the beginning. The Musicoterapia con l'arpa helped me because it helped me to open up, and this happened slowly and unconsciously without my noticing it. But each time it was a little better. I opened up. I had to isolate myself less and less. I could talk more. And so again, there was a growth of positive emotions. And that led me to live a life with real relationships. Normal. The way it used to be.